My name is Rasika. I work in HR. So the next topic, I would like to just do a quick brief about the topic and then about the respected speaker. When help is available, even somebody who's on the edge will reach out. And as a community, it's very much our responsibility to ensure that our fellow citizens, be it our friends, our neighbors, even strangers, are aware that we have their backs and we are there to support them and not look down upon them. So the topic for the next session is suicide prevention, a community responsibility. Dr. K.V. Kishore Kumar. He started his career as a senior psychiatrist at NIMHANS in Bangalore, and he was leading the community health services at that institution. He's also worked as an advisor to the Government of India on the National Mental Health Policy and District Mental Health Programs. He has also worked for Government of Karnataka on prevention of corporal punishment and on destitute relief centers. Dr. Kishore has advised the World Health Organization on mental health issues in Somalia in particular. He's worked in disaster-stricken sites such as Orissa, Jammu and Kashmir and Gujarat on psychosocial intervention programs. There are various areas in which he's done a lot of research. So to name a few, schizophrenia, bipolar disorder, epilepsy, disaster management, and mental health care in conflict zones. Currently, Dr. Kishore leads the clinical care team along with Dr. Gopi Kumar, and he is the director at the Banyan and the Banyan Academy of Leadership and Management. So I take great pleasure in passing the floor across to Dr. Kishore.
Thank you, Rasika. I don't know how to remove this. Good afternoon, everybody.
Good afternoon, sir.
It is wonderful meeting all of you. I have been asked to talk on role of community in preventing suicides. We all know that every one of us can play a very important role in preventing suicides for the simple reason that suicide is the most preventable cause of death. However, the burden of suicide is so high that we often get submerged in these figures, and we don't talk about what we can possibly do to reverse this process. Approximately 800,000 people commit suicides globally, and 17% of them are from India. So suicide rates has been gradually increasing. Suicides are higher in southern and eastern part of the country. Poverty, depression, substance use, domestic violence, and suicide-related problems are more in these locations. Every hour, one student commits suicide in India. The National Crime Records Bureau shows that 10,159 students died by suicides in 2018, an increase from 2017 and 2016. It goes without saying that every year we are seeing an increase in the trend of committing suicide. The Mental Health Care Act has decriminalized suicide from 2017 because in the earlier act it was supposed to be a crime to commit suicide. If you look at top 10 states in the country which have very high suicide rates, the suicide rates globally is about 12 per 100,000 population. But we have Sikkim to be 37.52, Chandigarh about 27, Telangana 27, Tamil Nadu comes 4, and so the figures goes on. So we need to understand why suicides happen despite the fact that we have mental health resources in the country. To just add to this point, there are 725 districts in India, out of which 600 odd districts are covered by district mental health programs. There are more than 500 medical colleges in the country. All the 723 districts have 10 bedded facilities in the form of district hospitals, and a large number of people work in the private sector. Despite that, suicides continue to be on the rise, which simply means that suicides and mental health resources are not directly related. There are many other factors which requires attention. So, the problem of suicides globally. So we have to look at now what is the cost of suicide for the community. These figures have not been generated from India, however, so these are global statistics. Average cost of one suicide is about uh, 13 lakhs $29,000 and odd. More than 97 So 97% of the cost was due to loss of productivity due to the person. Total cost of suicide and suicide attempts is a staggering 93.5 billion dollars. You can understand that there is a huge financial implication of suicide. Every dollar spent on psychotherapeutic interventions and interventions that strengthen linkages among different care providers saved $2.5 in the cost of suicides. So, preventing suicides, when we talk about preventing suicides, suicides are preventable. Preventing suicides is everyone's responsibility. Promoting health and well being of the community is an important way of working towards suicide. Empowering communities to identify and facilitate interventions such as health promotional activities, life skills education activities, support activities, buddy system, peer counseling, and so on. Building capacity of local healthcare providers and other gatekeepers in the community. Ensure that every individual realizes his or her full potential rather than hide, rather than end his or her life prematurely. If you look at what are the causes of suicide in our country, many people think that mental illness is the most leading important cause for suicides. It is important to note that there are many other psychosocial problems which is responsible. Indebtedness, bankruptcy is the highest. Marriage related issues is next. Non settlement of marriage is the third one. Dowry related deaths is the next one. Extramarital affairs, divorce, other kinds of failures in examination, poverty, unemployment, property dispute, suspected or illicit relationship, uh, illegitimate pregnancy, physical abuse, professional problems, and other kinds of things. Now, if you look at the distribution of death in males, it is poisoning, 31%, females it is 48, hanging by death is 26 in males and 24% in females, firearms is 16, very less in females, burns is 11, little more in females, drowning 10, little less in females. So if you look at the cause of death, it will be obvious that the organophosphorus poisoning has been an important factor in our country. Okay, And if we do something about it to reduce its availability, I think we are in a position to do something about the suicides per se. What is the role of the family? When we talk in the technological era as it stands now, many of us think that uh, there are many things that we can do. Like, for example, we have access to technology, dissemination of information is very high now. There is enormous amount of health education material that is available. There is a lot of mental health service available in the country. Yet we continue to see a trend which is increasing suicides in the country, as I had shown you some slides just before the present one. So the family members can identify problems like somebody who is being withdrawn, somebody who is using substances, somebody who is having relationship difficulties, and somebody who is experiencing academic problems in his life. So, improving communication with relatives is going to be a very, very important problem. Many people think that some of the problems have to be set as a secret in the family, and often that is a major source of concern. Many times, financial problems are not resolved, psychosocial, occupational, academic problems are not resolved, and many of these things remain alive, and therefore, the anonymity that is present in our country as the modernity is getting better and better, increasing, is likely to bring in a lot of suicides. Families can further identify unusual behavior, recognition of depression, seeking appropriate help as early as possible are some of the key important inputs the family can make. Strengthening bonds within the family so that there is transparency in all aspects of families dealing. Discouraging secrecy is also critical. So now if you look at what the family now all suicides occur in individuals who are living with families, who have friends, who have access to technology, who have relatives, and so on and so forth. Yet, these were not preventable. It simply means that at some level, there are failures in recognizing the overt signs that the individual may exhibit. And if that is not picked up, the suicide will eventually happen. What can educational institutions do? For example, educational institutions have an important role to play in preventing suicides, supporting individuals who experience distress by establishing counseling services, mental health promotional activities within the institutions. So, when I talk to people in educational institutions, teachers, school institutions, college authorities do not actually come forward to establish such activities. They say that it is stigma, we are not able to do anything. So, if that is the kind of commitment we show, then talking about suicide prevention, reducing suicides will continue to remain a distant dream. Today we are in a situation where we can deal with enormous amount of problems. We can produce a very good outcome for people with mental health problems, yet we lose a lot of lives by suicides. Debates on mental health topics, life skills education can be extremely useful. Developing a peer counseling program in the institution, identifying drug users and providing help for them. Sorry for the typological error there. Teachers, faculty to undergo training in dealing with problems of the young people. Now, I have been part of a very major program organized by the University Grants Commission. We have trained close to 10,000 college teachers in the country. And unfortunately, after we stopped that program because the funding stopped, the teachers also could not take this program forward. So, to take a program to provide counseling, to identify people at risk, offer all the support that is necessary, truly requires a lot of commitment on the part of the teacher. Now, what is the role of healthcare providers? For example, Australian studies show that every person who has committed suicide has contacted at least four care providers in the last 4 weeks prior to committing suicide, which means that most of them are are seeking help, but they are not getting the right kind of help. Is it that, or we are not taking suicidal ideation seriously so that they can receive appropriate help? And the fourth one is that there is no skill set that is available for people to ensure that they can provide care appropriately, because a large number of suicides are related to psychosocial problems, poverty, life difficulties, financial problems, occupational problems, than core mental disorders like depression and schizophrenia and bipolar disorder. So, therefore, talking about mental health problems as being responsible for suicide rather than focusing attention on distress, psychosocial problems in the community, and ways to mitigate it is going to be a very, very important thing. So, providing help for all persons who have attempted suicide is an important activity that we have to really initiate. In fact, in Bangalore city, as early as 1960, they started a program which focused attention on people who have attempted suicide. After they were revived, they were sent back home without any support, without any aftercare program. So, therefore, providing help is important. Attention to every person who talks about ending life rather than trivializing it is far more critical. Now, for example, if you talk about suicides repeatedly, people don't take you seriously. The earlier speaker was making a very, very valid point. You just need to approach that individual and maintain an engagement. Keep talking to him. You don't need to have very, very clear, right kind of skills to talk, but you keep that engagement going on. When he starts talking about the difficulties he is experiencing, 50% of distress would come down. He sees hope and postpones or even forgets about committing suicide. Regulating the prescription of benzodiazepines, a very, very common problem. It is very, very important to do this. For example, to just give you an example, in the early days of Corona, for example, in the second week and third week of April 2020, in Mylapore region, not a single benzodiazepine was available in any pharmacy because it just simply disappeared like hotcakes, which means many, many people used benzodiazepines and a lot of people used alcohol. Lot of drugs were used during Corona. In fact, the Corona crisis has brought to surface many, many problems that was not attended so far, particularly drugs, then other kinds of underworld activities, and all of these things are very, very important for suicide prevention. Antidepressants can be very dangerous when used without supervision. Role of the police, you have been talking, you have been listening to all the debates that is going on the press about drug use in different parts of the country, Maharashtra for example, Karnataka for example, and so on and so forth. So the lockdown period really drove all the drug dealers out into open to deal with drugs. Okay, so we will have to take strict action against people who are dealing with drugs. Better coordination
Dr.
between,
Kishore, because
so
we have a few
coordination
questions.
between the police and the law enforcing agencies and the drug control bureau, increasing community policing to control drug use, and patrolling around educational institutions. My last slide is talking about how building resilience is going to be important. Suicide is a multifactorial event, it is totally preventable. Family members should work towards improving communication. Please note, all people who commit suicide, they are part of a family, yet they commit suicide. So communication has broken down very, very seriously.
I was talking to myself.
Then, yes,
One of the questions that we've received is why is it that suicide is so common amongst the teenage population?
because they have very poor frustration tolerance. They are not able to postpone gratification, and therefore you often come across these kinds of problems in the younger population, less than 20 years of age. You know that till the age of 25, the evolving brain has many changes that is happening. In the process of this development, poor impulse control, inability to tolerate frustration, deep preoccupation with independence is a very problem, and therefore such people have to be dealt with very, very carefully. It is also important for us to note that the child rearing practices also have to be different, to show them that one has to be patient, one has to learn to share, one has to learn to be tolerant, one has to accept failures. Many times, all these important lessons that they have to learn during the formative years are not learned. So, therefore, many, many things contribute. One of the most important things that is happening is mine, me, and mine. That is going to be a very, very deadly combination to drive people to killing themselves, attempting suicide, and so on and so forth.
So the parents play a large role in the
Absolutely,
formative
parents
years.
play a very, very important role. And
Okay,
if they don't do that, today one of the biggest problems that they have is they say, I don't have time to take care of my child. If
right.
parents say, I don't have time to take care of my child, then nobody will be able to take care of your child. So, therefore, taking care of the child is absolutely important. Giving time to your child is absolutely important. The trust that
Okay,
is necessary between parent and child is not built overnight, it has to be occurring over a period of time. So, therefore, if parents are spending time to build that trust, give time to children, understand, not judge them, a lot of benefit can happen to these children.
sure. The next question we'll move on to is how can we educate and create suicide support groups?
Yes. The earlier speaker was saying that suicide support groups need not be professionals, it can be lay people. Educate lay people about what is distress, why distress happens, what is the context of distress, and how to deal with distressed individuals. Often these are very simple buddy system, simple process of developing friendship. For example, if there is an individual who is distressed, I reach out to him, talk to him, maintain that conversation, make him see that there are ways to solve the problem. The distress that the individual is experiencing results in completely fading away all the problem solving abilities in his own mind, and therefore he feels hopeless and thinks of ending his life. But he doesn't understand that there are clearly solvable problems. So you build capacity for volunteers, lay counselors. I and an organization called as Prasanna Counseling Center in Bangalore developed a voluntary force of close to 25,000 people in Bangalore city, where they were trained over a period of 6 months, 4 hours a week, and these people went into the community to provide support for distressed individuals, whether it is family problems, whether it is drug problems, whether it is strained relationship, whether it is extramarital affairs. So the table that I showed you, mental illness comes way down in the cause of suicide, whereas other life problems are the key ones.
Okay. Thank you, Doctor. Final question we have is, what is the importance rather of psychosocial economic interventions for suicide prevention?
Absolutely, it's a wonderful question. You know that one of the factors that mediate distress, giving up behavior is poverty. Now, poverty breeds a lot of poverty. Poverty is associated with depression, deliberate self harm, domestic violence, and suicides. So many a times, economic interventions like offering them a job, developing a skill based program so that they are employable, providing the support that is necessary at the right time. For example, we at the Banyan provided support for close to 1,000 families where we transferred monies directly to their accounts during the crisis period of 3,000 rupees a month, and these were all poverty stricken families. And to our great surprise, we found that no one committed suicide amongst those 1,000 families. So it was a very important contribution. I am not saying that this is the only way to resolve problems. Even the government of Tamil Nadu came forward to address the needs of disabled people. They provided them 1,000 rupees disability allowance for a period of 3 months. The revenue department offered support. A lot of volunteers offered support. So, COVID times are really the times when a psychosocial package of this nature became very, very relevant. A lot of people contributed and provided support. So, providing support of this nature gives them hope. Many people have died of hunger during this period, and this could have been prevented if appropriate action was taken. Even though we tried to do our best, we did lose some lives because this pandemic was a new one. It's a similar pandemic occurred 100 years ago, and there is no model that is very, very well available within our minds to be implemented quickly. So we will do very well in the next pandemic, which could be 50 or 100 years later.
Right. Okay. I think those were the questions that we received.
Yes.
Thank you very much for your extremely valuable inputs. I think it was very enlightening for me personally to sort of listen to you talk about what we can do as individuals, right? So as the
Absolutely.
layperson, what we can
Yeah.
do. I
Yeah.
think that's probably going to be a takeaway for each and every one of the
Absolutely.
participants here because
So
um,
yeah, the last word that I want to make Rasika is every family, every member, every teacher, every policeman, every significant citizen can contribute to suicide prevention. One, every individual should take responsibility to reach out to people if he is distressed. Rather than talking about ending life, explore possibilities, which is alternatives, and therefore life skills play a very, very important role in preventing suicides. Unfortunately, we talk about suicides on important occasions, but suicide prevention is not in our memory every day. Thank you very much.